Just say they are carotid arteries, they are jugular veins, you are good for me. Okay? So this one is our subclavian artery. So we said for chest it is subclavian, for shoulder it will be axillary. I'm not using the word shoulder for this one, I should use the word axilla. So this is where the armpit is. So if it's in between the head of the humerus and the axilla, so this one is axillary. For chest, this area is our subclavian artery. Here the same one is becoming axillary. Once it enters the arm, here it is brachial. So this is how these three names are varying. Okay? So in the chest, subclavian, in the axilla, axillary, in the arm, brachial, and then this brachial is dividing into these two. For the branches, I will go to this side. So this is where we have brachial, and brachial is dividing into radial on the thumb side, ulnar on the little finger side. This one is median, and this is where we are covering the arteries in the head and the arm.
Are you going to ask the BBC or no?
Which that sound veins. We have not started that yet. Okay. So in case of veins, I ask you to remember. So this one is our basilic. This one or this one are brachial veins. This one is our cephalic vein. Okay. So that's why I asked you to remember BBC. Okay. So basilic, brachial, cephalic. Okay. So once these two join, they make axillary, so it will be just next to axillary artery, it is axillary vein. Once the axillary vein and cephalic join, they become subclavian vein. Once the subclavian vein joins the jugulars, it becomes brachiocephalic vein. Okay, so this will be right brachiocephalic, this will be left brachiocephalic. So what will be this one?
That one will be subclavian.
So it will be subclavian vein. This will be jugular vein. Once they join, they make brachiocephalic. So I want you to understand this word. So one vein coming from the arm, brachio. One vein coming from the head, cephalic. That's why they are coining this word brachiocephalic. It makes sense?
Yes.
That's what we are looking for. So the two brachiocephalics, they will join to make superior vena cava. So that's where our superior vena cava is.
What is the inferior?
After this one,
Wait, he's going to tell you.
inferior is this whole thing. So all this part is inferior vena cava. In case of the legs, we are saying that there will be femoral arteries. So all these branches, they belong to femoral vein. This one is great saphenous vein. So this one is, I am asking you to remember specially, because it is the longest vein in our body. So great saphenous vein and femoral vein, they join to become external iliac vein. External iliac joins internal iliac here, and then they become common iliac. The common iliac of the other side, they join to become inferior vena cava. Inferior vena cava is collecting renal veins from the kidney. So you need to identify, this is one kidney, this is second kidney. This one is liver, but this one is spleen. You need to remember that. Once you fix these organs, so automatically you know this will be renal vein, this will be renal artery, this will be splenic artery, this will be splenic vein. So this one will be hepatic artery, but this one is hepatic portal vein. That's what I want you to remember. Okay? So hepatic portal vein is made of branches which are passing over the inferior vena cava. It's not joining inferior vena cava. If it will join inferior vena cava, it will be normal vein. Okay? So it's bringing blood. Technically this one is superior mesenteric vein. This one is a splenic vein. This one is gastric vein. But I am not asking you to remember them. I am asking you to remember just this one, hepatic portal vein. But if you look at this one and this one, they are collecting blood from liver and they are opening into the inferior vena cava. This is why they are normal. This is why they are hepatic veins. Okay? If they are connected, hepatic veins, if they are passing over, then hepatic portal. That's how I am asking you to remember. If I will be, okay, so we can't pull out the heart from here, so that's why we don't see the thoracic aorta. I showed you it from the mannequin. I will show you today also. And here it will be our abdominal aorta. So this red one is abdominal aorta. Okay. Though it is showing you celiac artery here, superior mesenteric here, inferior mesenteric here, I am less likely to ask them from this one. I am more likely to ask them from the mannequin where they are quite big ones and you can see them very, very clearly. Okay? And these are gonadal arteries. I don't know if your lab manual is showing them or
Yep.
not.
It does.
So this is what we covered in this area. Then finally, so what will be this one?
Those are veins, the arteries.
Pulmonary artery. So
Yeah.
this is what you need to remember when you will be labeling it. Inside lungs, color scheme is opposite. Okay. So blue will be artery, red will be vein. So that's what you need to remember about. And here we already did in, so this will be our brachiocephalic artery. This will be our carotid artery. This will be our subclavian. So we did that part already. Okay. Anything else?